Good afternoon. Thanks to you all for joining us here today on Facebook Live. My name is Mary McWilliams. I'm the retired Executive Director of the Washington Health Alliance and a member of the Virginia Mason Health System Board of Trustees. I'm here in Seattle with Dr. Gary Kaplan, a longtime practicing physician in internal medicine, and the Chairman and CEO of the Virginia Mason Health System. We're going to spend about 10 minutes talking about the Joint Commission's recent survey at Virginia Mason. The goal is to clarify the results of the survey, the actions Virginia Mason is taking to address those results, and most importantly, what it means for patients. To all of you who are watching, we encourage you to post comments and questions during this live stream event, and the team at Virginia Mason will respond to your posts as soon as possible following the live stream. So Gary, thank you for taking the time to respond to these questions.
Well, thank you, Mary. It's great to be with you today. We take the Joint Commission survey very seriously at Virginia Mason, and we want to be fully transparent about that process, what has happened and what hasn't happened. Unfortunately, the Joint Commission survey findings have been misinterpreted by the local media, and the result has been misleading, incomplete, and inaccurate headlines and news stories.
Well, there have been, as you say, news reports lately about the recent Joint Commission survey at Virginia Mason. Can you tell us about the survey?
Sure. Well, the survey is a voluntary survey. We actually invite the Joint Commission to visit with us every 3 years. The process is a routine process, and we actually look forward to the survey because it gives us a chance to have outside eyes present and help us identify opportunities for improvement, which is critically important to Virginia Mason. In fact, improvement's a way of life at Virginia Mason. The survey actually has over 1,800 elements, and it's actually quite common for a report to identify opportunities for improvement and to then schedule a follow-up survey. While we are compliant in the vast majority of standards and elements, there were some opportunities identified for improvement, and actually this is an anticipated and welcome part of our Joint Commission surveys every 3 years. The Joint Commission has several hundred standards, and within each of those standards are elements. And if in one place at one time an element is not compliant, then that entire standard is listed as an area of deficiency and opportunity for improvement.
Well, is there any possibility that Virginia Mason would lose its accreditation?
No, we are accredited today, and we will be accredited at the completion of the survey process. We have full confidence as a regular participant in these processes with the Joint Commission that any and all findings will be addressed to the Joint Commission's satisfaction.
Well, good. What has Virginia Mason done so far to address the survey results?
Well, we've engaged actively with our team members and focused on the categories. And just to mention a couple of those categories, medical staff bylaws, rules and regulations, the environment of care, attending to the safety of our facilities and our equipment, adhering to our instrument handling and processing practices, and then the provision of care in areas such as pain medication dosing, patient instructions. We are focused in all areas to ensure that we're complying with Joint Commission standards. I think one of the things that's important to keep in mind is that our leaders are very actively engaged in ensuring that every one of our over 5,000 team members understand the standard, understands the reason for the standard, and our teams are riveted on ensuring 100% compliance. Anything less than 100% for us is a disappointment.
Well, should patients be concerned about the quality of their care or their safety at Virginia Mason?
Absolutely not. I certainly understand why this might be a concern given the recent media reports, but we've been here for almost 100 years in this community, partnering with this community to deliver the highest quality care. We continue to be very highly regarded regionally, nationally, and internationally for the quality and safety of the care we provide. That has not changed. If anything, we are even more laser focused on this. In fact, I'll put our healthcare system up against any system in the world in terms of quality, safety, and the experiences that our patients have with us every single day.
Well, the Joint Commission raised some particular concerns about Virginia Mason's dialysis unit. What were those concerns, and how are they being addressed?
So thanks for asking that question. Certainly this was an area that was brought to our attention early in the survey process. Acute dialysis at Virginia Mason is provided by the Northwest Kidney Centers, and we partner with the Northwest Kidney Centers to provide these services. Most of our patients that receive dialysis only receive it when they're in the hospital, because on their ongoing routine dialysis, they get that dialysis at the kidney centers or in their local communities, whether they be in our regional community or in Alaska or elsewhere. We identified that there was that we were not ascertaining the hepatitis B status of patients before their dialysis. That is, of course, no longer the case. I think the nurses in the dialysis unit and the physicians overseeing the unit believe that patients were getting their dialysis screening, and believe correctly, in their local communities. One of the things that's happened since is they now fully understand the reason that this is a standard, and we are fully compliant. In fact, the Joint Commission returned 6 days later and told us that our resolution of this problem was best in class. And I'm very proud of our teams and the partnership with the Northwest Kidney Center that resolved this problem immediately.
So you sent letters to the dialysis patients to inform them of the issue. What did you share with them?
Yes, well, one of the things that's really important to us at Virginia Mason, and is really a core value, is transparency. And so we sent letters to 650 patients who had received dialysis while hospitalized at Virginia Mason over the last 5 years. We told them that it was important that they have their hepatitis B status ascertained and documented. We offered to help in any way possible with that. There have been no cases of hepatitis B transmission, and in fact, our experts, outside experts, and the King County Health Department all agree that there's a very exceedingly low risk of any transmission, and that's because we follow standard precautions, appropriate cleaning of dialysis equipment, hand washing, personal protective equipment, and things to assure that there is no transmission. But nevertheless, out of an abundance of caution, we reached out to our patients, and in addition, we held a media briefing. We said we don't want to leave any stone unturned. We want to make sure that patients understand that it's important that they have their Hep B status checked.
Any other Joint Commission findings you want to cite at this time?
Really, I think in the categories I mentioned, there were things like our code cart, which is the cart that is in place for emergent cardiopulmonary resuscitation, that every code cart in every room had a daily check, even if we weren't using those rooms at all. And so, of course, we have learned along the way, and we've also come to see that there may be small standards, but 100% compliance is really not negotiable.
So how would you describe Virginia Mason's response to the Joint Commission's findings and your overall approach to addressing the items that were flagged?
Well, I would say I'm very proud of our team. I think we come to work every day at Virginia Mason, as you know, focused on delivering the highest quality of defect-free, perfect care to every patient every time. And when that doesn't occur, that's a disappointment. And so our team, you know, was disappointed. I think it's what happens afterwards that's most significant. I think we are laser focused, as I said, on ensuring that we meet every standard. I think that we welcome the follow-up surveys. The Department of Health and CMS follow-up surveys are a routine part of the process. And I think we are very much embracing the opportunity to continue to improve. And as we've always done at Virginia Mason, I think challenges just make us better. And that's better for our patients and better for our community.
So what have you learned from this experience, both from the Joint Commission's issuance of its findings and from the pickup in the media?
Well, I have to say, it's disappointment that that a normal routine survey and survey processes and the routine Department of Health CMS follow-up, which comes with those surveys, has become a news story. this is certainly not unusual. This is something that occurs in hospitals across this region and across this country, and I'm confident that every opportunity for improvement that's been identified by the Joint Commission will be resolved to their satisfaction.
Well, finally, if people who are watching have any further questions about the Joint Commission survey results, what can they do to get their questions answered and the concerns addressed?
Well, not being a Facebook aficionado, I do believe they can post their questions, and our team and I personally will be very engaged in answering those. They can also email us at emailvm@virginiamason.org, and we'll look forward to more conversation with the community.
Well, Dr. Calvin, thank you very much for your leadership and for your transparency on this issue and many other things. I've enjoyed talking to you about it.
Thank you, Mary. I really appreciate the opportunity.